Hello everybody, welcome back to Join Academy. In this video, we're going to talk about the femoral triangle. The femoral triangle is simply an important anatomical landmark located in the body. It is a wedge-shaped area located within the superior medial aspect of the anterior thigh. It actually acts as a conduit for structures that are entering and leaving the anterior thigh. So in this video, we'll be looking at the borders of the femoral triangle, the contents of the femoral triangle, and some important clinical implications that is associated with the femoral triangle. The borders of the femoral triangle. The femoral triangle consists of three borders, a floor and a roof. The roof of the femoral triangle is formed by the fascial lata. For the floor, it is formed by the pectinatus, iliopsoas, and adductor longus muscles. For the superior border is formed by the inguinal ligament. So inguinal ligament is a ligament that runs from the anterior superior iliac spine to the pubic tubercle. For the lateral border of the femoral triangle is formed by the medial border of the sartorius muscle. The medial border of the femoral triangle is formed by the medial border of adductor longus muscle. So the rest of this adductor longus muscle forms part of the floor of the femoral triangle. So let's briefly talk about inguinal ligament. Inguinal ligament acts as a flexor retinaculum that is supporting the contents of the femoral triangle during flexion at the hip. It is important we note that some sources consider the lateral border of the adductus longus to be the medial border of the femoral triangle. However, majority states that it is the medial border of adductus longus, and this is the definition we have gone with. Okay, so is this particular definition that the medial border of adductus longus forms the medial border of what? The femoral triangle. Let's look at the contents of this femoral triangle. The femoral triangle contains some of the major neurovascular structures of the lower limb. So these contents in its arrangement from the lateral to the medial side, we have the femoral nerve, the femoral artery, the femoral vein, and femoral canal. Okay, so these are the contents of what? The femoral triangle. The femoral nerve innervates the anterior compartment of the thigh, and it provides sensory branches for the leg and foot. As for the femoral artery is responsible for the majority of the arterial supply of the lower limb. For the femoral vein, the work of the femoral vein is that great cavernous veins drains into this femoral vein within the triangle. And for the femoral canal, it contains deep lymph nodes and vessels. One important thing we should note about the femoral triangle is that the femoral artery, femoral vein, and the femoral canal are all contained within a fascial compartment that is known as the femoral sheath. So, important acronym that you can use to remember the contents of the femoral triangle according to the arrangement from the lateral to the medial side is NAVEL. N stands for nerve, A stands for artery, V stands for vein, E stands for empty space, and the work of this empty space is that it allows the veins and the lymph node to distend in order to accommodate different level of flow. Okay, while L stands for lymph nodes. Let's look at some of the important clinical anatomy, clinical implication that is associated with what? The femoral triangle. One of the most important clinical implication is femoral pulse. Okay, another one is the assessment of the femoral artery. And another important clinical implication is the femoral hernia. So let's take them one after the other. Just inferior to where the femoral artery crosses the inguinal ligament, it can be palpated to measure the femoral pulse. The femoral artery crosses exactly midway between the pubic symphysis and anterior superior iliac spine. This point is known as the mid-inguinal point. The next clinical importance of the femoral triangle is the assessment of the femoral artery. The femoral artery is located superficially within the femoral triangle, and it is therefore easy to assess. This makes it suitable for a range of clinical procedures. One of such procedures is known as coronary angiography. In coronary angiography, the femoral artery is catheterized with a long thin tube. So this tube is navigated up to the external iliac artery, the common iliac artery, the aorta, and then into the coronary vessels. A radio-opaque dye is then injected into the coronary vessels, and any wall thickened or blockage can be visualized through the X-ray. The last clinical importance of the femoral triangle is femoral hernia. A hernia is simply defined as a condition in which part of the organ is displaced and protrudes through the walls of the cavity containing it. In the case of femoral hernia, part of the bowel pushes into the femoral canal underneath the inguinal ligament. So this manifests clinically as a lump or bulge in the area of the femoral triangle. It usually requires surgical intervention for it to be treated. Thank you so much for your time. Please don't forget to subscribe and share. See you next time.